Command Center. This is Y News.
Good evening, Philippines and the world. Today is Wednesday, May 20, 2020. I am Herlene Delgado.
Join us for the next 45 minutes as we deliver today's top stories around the globe. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media pages and our website, untvweb.com. I am William Theo.
And here are the top stories tonight. President Rodrigo Duterte warns of implementing enhanced community quarantine again if cases of coronavirus disease to 2019 mount.
Once available, the president will procure vaccine against COVID-19.
The World Health Organization commits to continue providing strategic leadership to coordinate the global response against COVID-19. Hospital ng Malabon partially suspends its operation.
South Korea reports 32 new coronavirus cases as schools reopen.
Brazil seems to be losing its battle against COVID-19, says a medical center director in Sao Paulo. First in the news, President Rodrigo Duterte warns of implementing enhanced community quarantine again if cases of coronavirus disease 2019 mount. Malacanang clarifies relaxing the quarantine measures does not mean the Philippines is already safe from the fatal respiratory disease. President Duterte says he will not hesitate to impose stricter quarantine restrictions again in various parts of the country if the number of coronavirus infections spike.
If the contamination will be as fast as before and it will continue to infect yung nakalabas na, then we'll have to just go back to the program.
The National Task Force versus COVID-19 explains what it will do is limit the lockdowns per barangay and not region or city-wide. The president also says that once available, he will immediately procure the necessary vaccine against COVID-19. He adds it might be available by January 2021. Let's listen to this.
May pera ako pangbili ng vaccine just in case somebody else would beat the Moderna to the vaccine. I think China has already won. We're just waiting for the announcement. Many countries are on the verge of malapit na sila sa vaccine. Naghahabulan.
Since the first local transmission of coronavirus disease in the country in March, many have been appealing to the government to conduct mass testing to determine, isolate, and treat those who have been infected by the deadly virus. But after more than 2 months, Malacanang insists mass testing is not possible. Rosalie Cos, who is monitoring statements from the palace on this expanded targeted testing, will now tell us why.
The Philippine government implements expanded targeted testing, which Presidential Spokesperson Secretary Harry Roque describes as the global benchmark. Through this, the country targets to test 1.5 to 2% of the country's population or 1.6 to 1.95 million individuals.
Sabi ko nga po, walang bansa sa mundo ang kayang mag-test ng lahat ng kanilang mamamayan. Ang susi sa testing ay work on benchmarks. Ibig pong sabihin, nito ay 1 to 2% of the population of the entire country, or in the case of an epicenter, even higher than up to 10%.
But what is the country's rate of performance in its expanded targeted testing? According to a recent National Task Force on COVID-19 report, as of May 16, the Philippines has conducted 184,857 individual tests for COVID-19. Although the government failed to reach the 8,000 tests per day on April 30, it has now attained 11,509 tests per day. However, according to the report of our World in Data, a scientific online publication, the Philippines is only able to test 1.7 per 1,000 population for COVID-19. Compared with other nations which have contained the coronavirus better, this number is much lower. New Zealand, for instance, which has almost 5 million population, conducts 48.8 tests per 1,000 residents. Australia, with 25 million population, is able to test 42.5 for every 1,000 individuals, while in Singapore, the ratio is 42 tests per 1,000 people. In the US, which has the highest rate of coronavirus infections in the world, the government tests 34.087 per 1,000 individuals. Rosa Licos, UNTV News and Rescue. We serve the people, we give glory to God.
The Department of Health states that what the Philippines is experiencing is a second wave of COVID-19 infection. Aiko Miguel, who monitored the Senate committee hearing on the COVID-19 shutdown in the country, will tell us why.
During the Senate committee hearing this afternoon, Health Secretary Francisco Duque III said the Philippines first experienced the first wave of COVID-19 in the country in January. Based on epidemiologists' report, the first wave of the infectious disease occurred when the first 3 cases were recorded, the 3 Chinese nationals from Wuhan City, China. The health chief assures the DOH is strengthening various measures to prevent a third wave of infections, like expansion of country's healthcare system and the implementation of the minimum health standards. It was on May 7 when Dr. John Wong, an epidemiologist and member of the IATF Sub-Technical Working Group, reported that the country is experiencing the second wave of COVID-19. Meanwhile, the Health Department clarifies the pronouncement of President Rodrigo Duterte that there will be a COVID-19 vaccine as early as January 2021 from an American biotech firm, Moderna Incorporated.
Meron tayo ngayon na mga iba't ibang bakuna na ginagawa all over the world, and we find articles every day na nagsasabi. Of late, Sanofi has announced na meron na sila, mag-start sila ng kanilang trials by the third quarter of this year. Sa atin dito sa Pilipinas, yung pong ating mga efforts would be for us to join unang-una yung WHO Solidarity Trial for vaccines. Nakapila tayo dyan, and we have already stated our intention sa WHO na pag nag-umpisa sila, sasali tayo.
The Solidarity Trial is being conducted in the country using the 4-drug combination recommended by the WHO. The DOH says the clinical trial for a vegan or favipiravir, an anti-flu drug from Japan, will happen in 3 medical facilities in the country: the Philippine General Hospital, Santa Ana Hospital, and Jose N. Rodriguez Memorial Hospital and Sanitarium. The DOH awaits the supply of a vegan from Japan for the trial to start. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, the Philippine Coast Guard served 539 OFWs and returning Filipinos from our Asian neighbors, Japan, China, and South Korea yesterday. Each of our returning nationals submitted their case investigation forms, after which they underwent specimen collection for COVID-19 RT-PCR testing and when they were transported to their designated quarantine facilities. Authorities advised them to comply with quarantine measures strictly while waiting for their swab test results and quarantine clearances. The Bayanihan Repatriation Program for OFWs and returning Filipinos is part of the efforts made by various government agencies amid the COVID-19 crisis. The Philippine Coast Guard announces a new list of additional 2,044 returning OFWs who have tested negative for COVID-19. The results were confirmed through RT-PCR testing. Their quarantine clearances will be released through the Overseas Workers Welfare Administration, or OWA, or their respective manning agencies any day this week. To find out who are those cleared, more than 2,000 cleared OFWs, just visit the Philippine Coast Guard social media pages. Meanwhile, the Department of Foreign Affairs reports 24 new confirmed COVID cases among Filipinos abroad. That brings the total COVID-19 cases among our nationals overseas to 2,455. Today's figures also include 9 new recoveries and 4 new deaths. These numbers reflect a decrease in the daily rate of recoveries based on DFA's report through its foreign service posts. 1,313 are undergoing treatment. 858 have already recovered. The death toll has reached 284. These figures come from 46 countries and regions with Filipino COVID-19 cases like in the Asia-Pacific region, the Americas, the Middle East and Africa, and Europe. Some preclinical evidence suggests that hydroxychloroquine might be useful in the fight against COVID-19. A British academic says this anti-malaria drug, which is now being tested on COVID-19 patients, has other uses as well. Rheumatoid arthritis, for example. He says, however, there is still a lot we don't know about this drug. Jovic Vermas, who is now in the United Kingdom, will tell us why.
There is limited laboratory-based evidence that shows malaria-fighting drug hydroxychloroquine could be effective in treating COVID-19 patients. A scientist here in the UK says there's a lot we don't know about hydroxychloroquine, particularly in relation to COVID-19. According to Dr. Michael Head, Senior Research Fellow in Global Health at the University of Southampton, hydroxychloroquine even has side effects when not used the proper way.
There's a lot we don't know about hydroxychloroquine, particularly in relation to COVID-19. We know the drug does have side effects when used anyway, so it can cause nausea and vomiting. It can give you problems with the heart. It can even cause, in some rarer cases, seizures and delirium as well. So it is not a drug without side effects. So going against recommended usage is not at all ideal.
Medical journal publisher BMJ published 2 new studies on May 14th that showed little significant difference between COVID-19 patients who had taken the drug and those who had not. BMJ also cited there is no convincing evidence from well-designed clinical trials exists to support the use of chloroquine or hydroxychloroquine with good efficacy and safety for the treatment of COVID-19.
Extra side effects seen in populations from those drugs, so we're using them without a proper prescription. We will see possible supply chain issues if hydroxychloroquine is used by many people for conditions for which it is not recommended.
Jovic Vermas, UNTV News and Rescue. We serve the people. We give glory to God.
The World Health Organization stands firm it will continue to lead the global fight against the coronavirus pandemic. According to WHO Director General Tedros Adhanom Ghebreyesus, COVID-19 has endangered the lives and the livelihoods of people.
COVID-19 has robbed us of people we love. It threatens to tear at the fabric of international cooperation. But it has also reminded us that for all our differences, we are one human race. And we are stronger together.
The WHO Director General thanked the member states who have expressed their support and solidarity during its two-day annual Ministerial Assembly. We welcomed a European Union resolution adopted by consensus by WHO's 194 member states that calls for an independent evaluation of the international response, including but not limited to WHO's performance.
We will continue providing strategic leadership to coordinate the global response and support the efforts by the countries.
He made no reference to a threat by U.S. President Donald Trump. Contained in Trump's letter to WHO tweeted overnight to permanently halt funding for the WHO if it did not commitment to improvements within 30 days to reconsider U.S. membership. Mariela Toza, UNTV, News and Rescue. We serve the people, we give glory to God.
And now let's take a closer look at the updated count of coronavirus cases around the world. The COVID-19 pandemic has now reached a total of over 4.9 million confirmed cases in 188 countries, regions, and sovereignty. The fast-spreading disease has claimed more than 323,000 lives, while more than 1.7 million patients across the globe have recovered from the new coronavirus infection. The United States of America, as of today, has recorded more than 1.5 million known cases and remains to have the most confirmed cases in the world, including almost 92,000 deaths. Russia has gradually trailed the United States, while Brazil has surged past the UK. On the other hand, India remains to be the only Asian country in the top 12 of this tally of COVID-19 hit nations, with almost 107,000 confirmed cases. And in the Philippines, the Department of Health reports 279 new cases, bringing the total patients infected with the COVID-19 virus in the country to 13,221. That's based on the Health Department's 4 p.m. report as of today. We have lost 5 more patients. Now the country's death toll stands at 842. With the help of our valiant medical frontliners, 89 more people have won their battle against the invisible enemy. That brings the total recoveries nationwide to 2,932. The remaining active cases in the Philippines are 9,447, according to the Department of Health. Up next on Y News. Hospital ng Malabon partially suspends its operations. The PNP Highway Patrol Group implements mobile checkpoints amid MECQ. President Duterte vouches for and keeps Police Major General Dipolg Sinas as NCRPO chief, while the PNP supports the president's statement. More reasons behind the stories when Y News returns.
This is a message to all of our frontliners in the media. We really appreciate what you do for the people and for our country. Being out on the field working now puts your health at risk and also compromises certain things like uncertainty and of course anxiety from being away from our families and our homes. But we'd like to let you know that we consider you our heroes as you continue to bring facts, the news to us, therefore giving the people who are on enhanced quarantine at home peace of mind, knowing what is really going on in the field and all over the country, because all we really have is you. So my message to everyone is to stay safe, use your personal protection equipment, and always give everything to God and always pray. We hope to see all of you after this. Take care. God bless. Salamat sa Diyos sa lahat sa inyo.
Good news mga kasambahay dahil inaanyayahan namin kayong gumawa ng sarili ninyong lockdown stories. I-share nyo sa amin ang inyong istorya habang nasa ECQ. Ipadala nyo sa amin ang complete production o edited video ng inyong lockdown entries. Alam naman po natin na lahat tayo ay mayroong kakaiba at magagandang istorya dahil sa Enhanced Community Quarantine. Ang mapipiling entries ay ipapalabas po namin sa Serbisyong Bayanihan Program at i-upload sa Facebook at YouTube channel ng UNTV. At magbibigay din po kami ng cash prize sa mga mapipiling istorya. Kaya ano pang hinihintay nyo? Share your lockdown diary entries at isend sa email address ng Serbisyong Bayanihan. Para magkaroon kayo ng idea, maaari nyo pong panoorin ang full episode ng aking lockdown diary sa UNTV News and Rescue Facebook page at YouTube channel.
Kaibigan, huwag ka na munang lumabas ng inyong bahay. Maliban na lang kung bibili ng pagkain o may emergency. Tandaan ang mga sumusunod. Kung kailangang lumabas ng bahay ngayong may enhanced community quarantine, magsuot ng mask. Siguruhing may 1 metro ang layo sa ibang tao. Magdala lagi ng alcohol o alcohol-based hand sanitizer. Huwag hawakan ang iyong mukha. Bago naman pumasok ng bahay, maghugas ng kamay gamit ang tubig at sabon sa loob ng 20 segundo o kaya mag-alcohol o sanitizer. Isprayan ng disinfectant ng mga sapatos at iwan ang mga gamit sa may pintuan. Maligo at ilagay ang pinaghubaran sa hiwalay na laundry bag at labhan agad. Ilagay sa hiwalay na tapunan ang mga gamit na gloves at face masks sa loob ng 3 araw bago itapon at ipakolekta. Sa wastong pag-iingat, ang virus hindi kakalat. COVID-19, kayang-kaya nating tapusin.
Y News continues. Hospital ng Malabon suspends part of its operations. Those will resume on Monday, May 25. Asher Kadapan Jr., who monitored the situation in Osmal, will give the details why.
The operations of OB/GYN clinics, pediatric section, and delivery and surgical units in Hospital ng Malabon have been suspended since yesterday to disinfect the facility. This move comes after a COVID-19 exposed female patient from Barangay 12, Caloocan City was admitted and gave birth in the hospital. According to Malabon City Public Information Office, the patient did not disclose to the hospital personnel her real situation regarding her exposure to COVID-19.
Bago siya dinala sa operating room, tinanong siya kung siya po'y na-expose sa COVID-19 at may mga tanong po sa kanya na may kinalaman din sa COVID-19 at nagsinungaling po siya.
After yielding positive for COVID-19 through rapid testing, 13 health workers were forced to undergo quarantine and COVID-19 testing. Malabon City Legal Office prepares for cases to file against the patient for violation of Republic Act 11332 or the Mandatory Reporting of Notifiable Diseases and Health Events of Public Health Concern Act. The patient has already been referred to the Caloocan City Health Office. Operations in the units of Hospital ng Malabon undergoing disinfection will resume on Monday, 25th of May. Asher Kadapan Jr., UNTV News and Rescue. We serve the people. We give glory to God.
The coronavirus disease pandemic has changed the way people move and transact in the country's main fish center, the Navotas Fish Port. Ray Pelayo, who observed the transactions at the fish port, will tell us why.
Upon entry at the Navotas Fish Port, it can easily be noticed that strict screening protocols are in place. Each arriving vehicle goes through disinfection. Every individuals must also disinfect in designated foot bath and wash areas before entering the facility. Body temperature check is also implemented. To maintain physical distancing, only 50% of the previous number of traders are allowed inside the facility. That's according to Dr. Mario Pascual, president of Navotas Fish Traders Association. They also adjusted the start of the facility's nighttime operation from the previous 6 p.m. to as early as 4 p.m.
Mas mahaba na po yung oras nila ng pamimili dito at naiiwasan po yung pagdagsa ng tao na sa limitadong oras lang.
The presence of police personnel is also evident. Protocol officers are visible to ascertain the necessary health measures are observed, such as wearing of face masks and social distancing. Even the bidding process has changed in order to comply with the new health protocols. Bidders are now required to write their bids in a piece of paper and hand them over to broker. Traders here at the Navotas Fish Port say they feel the impact of the coronavirus outbreak. Ray Pelayo, UNTV, News and Rescue. We serve the people, we give glory to God.
Meanwhile, mass transport remains suspended in areas under modified enhanced community quarantine. Now the demand for bicycles has gone up. Dante Amento tells us why.
When the modified enhanced community quarantine began in Metro Manila, some establishments were allowed to partially open, including malls and shopping centers. But mass transportation remains suspended. Thus, employees who don't have their own car or not provided with shuttle service by their companies opt to use bicycles as an alternative way to get to their workplaces. Rodrigo Lisondra, a policeman who works inside Malacanang, bought his own bicycle. Based on the new IATF guidelines, bicycle can be used for transportation for one person only.
Kaya nga bumili ako nito kasi bawal talaga may back ride. So nakakahiya naman, pulis kami tapos kami pa mangunguna sa di ba?
Sa hirap na natin, transportasyon natin. Parang yun na lang yung pinakamadaling option. Magbike na lang.
Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
The Energy Regulatory Commission, or ERC, has sent a letter to Meralco asking the giant power distributor to submit all the necessary documents explaining the sudden spike of power rates during the ECQ period. Several customers have been complaining their electric bills have skyrocketed. In today's episode of Get It Straight with Daniel Razon, the ERC, a former lawmaker, and the Bagong Generacion Party List representative Bernadette Herrera D faced off. Joe Anano, our eyes and ears for consumer-related issues, will tell us why.
ERC Commissioner Agnes Devanadera, former congressman and now chairman of Matuwid na Singil sa Kuryente Consumer Alliance Incorporated Nery Colmenares, and BH Party List Representative Bernadette Herrera D, tackled today the controversy surrounding Meralco's power rate hike during the ECQ period. According to the ERC, their investigation has kicked off and demands Meralco to do some explaining. Commissioner Devanadera explains that under the ERC rules, power rate should be equitable and reasonable for consumers.
If there is a mistake, different. Kaya naman sinabi ko, investigation na yung ginagawa namin. Hindi naman basta advisory. Dinig namin, damdam namin, at nasa puso namin ang mga hinaing na inyong inilahad ngayon. Yang mga hinaing na yan, ang rason din kung bakit ang ERC is taking the bull by its horn.
On the other hand, the consumer group which Colmenares leads is asking the ERC to suspend the payment for high electric bills while the probe is underway. They are also asking if the Commission could order Meralco to condone a one-month consumption consumers.
Hindi dapat singilin muna ang mga bills na ito. Kasi hirap ang tao ngayon. Dadagdagan mo pa ang problema niya. Tapos in the end, what if in the end pala, overcharge yun. So, ang hirap mag-refund sa Meralco, hindi ganun kadali yun. Hindi ba pwedeng i-condone mo muna yung isang buwan man lang? Tulong mo na yan sa lipunan.
Meanwhile, BH Party List wants to further extend the deadline of payment for basic utilities beyond the ECQ period. Representative Herrera D argues that people should be given time to adjust and earn money post-ECQ to have the financial ability to pay their bills.
Kasi hindi mo naman ina-expect may pera kaagad ang tao pagbalik eh. Diba? Siyempre, kailangan magtrabaho muna yan bago siya makaipon ng pangbayad ng Meralco niya.
According to the ERC, Meralco has committed to suspend the disconnection service during the ECQ even if customers fail to pay their bills under the Bayanihan to Heal as One law. It adds that any unreasonable price hike of basic utilities implemented during the community quarantine are violations. Johanano, UNTV News and Rescue. We serve the people, we give glory to God.
President Rodrigo Duterte defends the National Capital Region Police Office Chief from allegations surrounding the police official's birthday celebration. Rosalie Cos explains why.
President Rodrigo Duterte himself says that he does not want NCRPO Chief Major General Debold Sinas to be transferred to different assignment or removed from his post. This is amid the criticisms against the police official's birthday celebration, which allegedly violated the quarantine protocols.
Kailangan ko yung tao. Mas kailangan ko yung tao dito sa trabaho niya. I do not believe in just firing him because kinantahan siya ng happy birthday.
For the president, Major General Sina should not be blamed for what happened.
Sabi mo, the law is the law. Well, akin na yun. It's my responsibility. But I will not order his transfer. He stays there.
Sinas has apologized for what happened. He says that some of the pictures released in relation to his birthday had been altered and were old ones. Rosalie Cos, UNTV, News and Rescue. We serve the people, we give glory to God.
The Philippine National Police leadership supports the president's statement that Police Major General Debold Sinas will remain as Metro Manila's top cop, but charges against the NCRPO officials and personnel with liabilities will proceed according to the PNP. Leia Ilagan, who is monitoring this issue, will give us the details why.
NCRPO Director, Police Major General Debold Sinas will remain as Metro Manila's top cop. PNP spokesperson, Police Brigadier General Bernard Banac says the PNP leadership supports President Rodrigo Duterte's statement that he is keeping Major General Sinas in his post. Banac adds there will be no movement among the NCRPO personnel involved in the controversial Mañanita last May 8 when the NCRPO chief celebrated his birthday.
Patuloy na maglingkod si Police Major General Debold Sinas as Regional Director ng NCRPO sa gitna nitong ating pinapatupad na Modified Enhanced Community Quarantine.
However, the criminal and administrative cases which the PNP Internal Affairs Service has filed against Sinas and 18 other NCRPO officers and personnel will proceed.
Wala pong ipangamba ang ating publiko dahil ang mga naisambang kaso ay umusad naman at magpapatuloy kahit manatili sa pwesto ang mga inasuhan.
For his part, Police Major General Sinas is thankful to the President and to the PNP Chief Police General Archie Gamboa.
Thank you po, Mr. President, for the trust and confidence sa mga tauhan ko po at saka yung si Chief PNP talagang hindi po ako binitawa at sa kumpanya ko. Pagpatuloy po namin yung mga nagawain sa NCRPO na stakeholders sa publiko.
Leia Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.
During the enhanced community quarantine, the police installed several checkpoints on Enza. But since last weekend, those checkpoints are gone. Leia Ilagan is back to tell us why.
The PNP Highway Patrol Group confirms it is temporarily pulling out its personnel assigned to man checkpoint on EDSA. The pullout began as modified enhanced community quarantine started across Metro Manila last weekend. HPG NCR Chief Police Colonel Wilson Doromal explains, this move aims to prevent heavy traffic on Metro Manila's busiest thoroughfare as businesses reopen and there are more authorized persons outside of residence or APOR.
Iniiwasan na natin yung stationary checkpoint kasi nagkikreate siya ng traffic. So humahaba yung traffic kung ating sisitahin.
What the HPG is implementing right now is mobile checkpoints. 40 motorcycle rider cops are deployed to screen motorists randomly and those mobile checkpoints placed across Metro Manila. They will run after the motorist with violations, check if they are authorized to be outdoors, and apprehend vehicles loaded with a number of passengers more than what is prescribed in the MECQ guidelines.
Ito sa ating offline habol, makikita naman natin kung ano yung may mga violator. Katulad ito, may backride siya, bawal agad dyan. Yung mga tricycles, nakita natin. At yung mga motor vehicles na lampas po sa capacity na karga niya, yung overloading na tinatawag.
The PNP HPG will confiscate the violator's driver's license in exchange for a temporary operator's permit. HPG personnel who manned EDSA checkpoints are now deployed in Katipunan, Commonwealth, Quezon Avenue, C5, Quirino, Marcos Highway, and Rojas Boulevard to supervise checkpoints in those locations for 2 up to 4 hours in each area. Leia Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.
And still to come in Y News. South Korea reports 32 new coronavirus cases as schools reopen. Brazil seems to be losing its battle against COVID-19, says a medical center director in Sao Paulo. Taiwan swears its current president for a second term. Y News will be right back after this quick break.
Para sa lahat ng frontliners na umaapaw ang sakripisyo, serbisyo, dedikasyon at malasakit sa bawat Pilipino, maraming salamat po. Kayo ang tunay na bayani ng ating bayan. Saludo po kami sa inyo.
Isang paalala mula sa DOH, PCOO, KBP at ng himpilang ito.
Ang tama at maling paggamit ng alcohol bilang disinfectant. Karaniwang ginagamit na disinfectant ang alcohol kung hindi agad makapaghuhugas ng kamay. Inirekomenda ng DOH ang paggamit ng 70% alcohol. Hindi inirekomenda ang mas mataas na percentage dahil kailangan ang sapat na dami ng tubig para makapatay ng mikrobyo. Ang methanol at ibang uri ng alcohol na ginagamit sa industriya ay hindi rin inirekomenda dahil makasasama ito sa kalusugan. Ang alak o alcohol beverages naman ay hindi epektibo bilang disinfectant dahil 40% lang ang taglay nito. Huwag haluan ng bleach ang alcohol dahil nakakalikha ito ng kemikal na kapag nalanghap ay makasasama sa kalusugan. A reminder from UNTV, your public service channel. Paano na ipapasa ang coronavirus disease 2019? Naipapasa ang sakit sa pamamagitan ng direct contact at paglanghap ng droplets mula sa bumahing o umubo na taong may sakit. Pwedeng tumalsik ang droplets mula 3 hanggang 6 na talampakan posibleng makuha ang virus channel. Mga pagkain na makatutulong magpalakas ng immune system, kamote at talbos ng kamote. Pagkain ng National Nutrition Council. Ang kamote ay isa sa mga pagkain na may pinakamataas na vitamin A. Ang vitamin A ay nakatutulong mapalakas ang immune system, labanan ng impeksyon at para maging malusog ang respiratory system. Ang kalahating tasa o 100 grams ng kamote ay sapat para mapunan ang kailangan na vitamin A ng katawan sa isang araw. Ang talbos ng kamote naman ay nagtataglay ng iron at polyphenols na makatutulong laban sa impeksyon. Tandaan na ang tamang pagkain ay makatutulong labanan ang sakit. A reminder from UNTV, your public service channel.
Manibela.
Kung kayo ay makasasaksi ng isang aksidente, mayroon ba kayong maaaring maitulong? Sa Metro Manila pa lamang, tinatayang 262 vehicular accidents ang naitatala araw-araw. Kalimitan itong nauuwi sa iba't ibang mga injury at kung minsan ay may pagkasawi dahil na rin sa kakulangan ng kaalaman sa pagtugon sa emergency. Manood ng Lifesaver upang matuto ng mga paraan ng emergency response nang kayo ay makatulong sa pagsalba ng buhay kung kayo ay bystander sa isang sakuna. Tandaan, mahalaga ang kaalaman at abilidad. Para sa oras ng kalamidad, ikaw ay Lifesaver.
Y News continues. Bills filed at the lower house of Congress pertaining to ABS-CBN Corporation franchise will progress beginning next week. Vincent Arboleda will give the updates why.
A total of 13 bills and a resolution will be tackled on Tuesday next week by the Legislative Franchise Committee of the House of Representatives for its virtual hearing on the ABS-CBN franchise. This was after the House leadership decided to drop House Bill 6732, which aims to give provisional franchise to ABS-CBN until October 31, 2020. House Speaker Alan Peter Cayetano says they want to have an impartial and comprehensive hearing on the issue before deciding on whether to give or deny ABS-CBN a 25-year franchise. The hearing will also try to shed light on allegations against the giant media network concerning labor laws, citizenship, and taxes. The House Speaker assures that every side will be given time to be heard by the body. The committee will conduct 2 to 3 hearings every week, according to Cayetano. Cayetano adds that despite the upcoming recess of the session of the lower house, the Legislative Franchise Committee will continue to conduct hearings on the issue. The House Speaker also says that with the Legislative Franchise Committee tackling the ABS-CBN franchise, other lawmakers and committee can now focus and continue trying to pass measures to respond to the COVID-19 crisis in the country. Cayetano estimates that the hearings on the ABS-CBN franchise may be finished by July and ready to be presented to the plenary by August. Vincent Arboleda, UNTV, News and Rescue. We serve the people. We give glory to God.
Meanwhile, the Department of Finance is studying the possibility of taxing online streaming services and commerce. In today's Senate committee hearing on taxes from online streaming services and digital economy, a similar proposed measure has been filed by Albay Representative Joey Salceda in the House of Representatives.
So right now, our team from the BIR and from the DOF is working very hard to determine this the way to tax transactions that are supposed to be taxed but are escaping taxation because they are on the internet.
PNP Chief Police General Archie Gamboa orders another round of reorganization of several senior police officials that occupy key positions. Former PNP spokesperson Police Major General Leonardo Carlos takes the helm of the Directorate for Police Community Relations. This is the primary unit of the national headquarters for its police community affairs and media relations programs. Carlos replaces Police Major General Benigno Durana Jr., who retires today. Durana, who has served more than 3 decades in police and military service, was also the Chief of Public Information Office. Carlos, on the other hand, was the former Director for Information and Communications Technology Management, or DICTM. Meanwhile, Police Major General Joselito Vera Cruz will replace Carlos as the head of the DICTM. Former Regional Director of Police Regional Office 12, Police Brigadier General Alfred Corpus, will take the helm as the new Director of DIPO in Western Mindanao. Associate Chief Police Brigadier General Michael John Dubria will replace Corpus as the Socsargen's top cop. Gamboa also designated Police Colonel Sidney Villaflor as acting chief of the Supervisory Office for Security and Investigation Agencies, or SOSIA. The new designations take effect today, May 20th. And for the news abroad, here's Kath Dumaraos live from Thailand. Kath, good evening.
Good evening, William, and of course to Diego and Harleen.
Thailand proceeded with the second phase of easing COVID-19 related restrictions on Sunday. Is that right, Kath?
Absolutely, William. Businesses like shopping malls, restaurants, large retails, and wholesale shops are now allowed to operate as long as they follow health precautions and physical distancing. The government has also set certain additional measures even in restaurants.
Well, Kath, tell us why.
All right, William, here in Thailand, one new step the government has introduced to the public, aside from using face masks and hand sanitizers and temperature screening, is to check into Thaichana. This Thaichana is a website where shoppers can scan a QR code. They are required to register their phone numbers upon entry to a business establishment. This will allow the government to trace any contact if a coronavirus outbreak occurs. If a shopper doesn't have a mobile phone or internet access, they can write down their details instead. According to Dr. Tawisin Wisanuyotin, spokesman of the Government Center for COVID-19 Situation Administration, more than 67,000 businesses nationwide registered in the program as of yesterday, May 19. And beyond 5 million members of the public have used the platform. Meanwhile, restaurants that have reopened doors are required to follow new dine-in measures, just like installing partitions between seats, waitstaff putting on personal protective equipment, and sanitizing the seats and tables whenever a customer leaves. The government has reported one new case of the coronavirus disease infection today, raising the total to 3,034, although no new deaths were recorded today. South Korea reports 32 new cases today. This number includes 24 cases from local communities, plus those related to Itaewon nightclubs and 8 cases of overseas inflow. This brings the national tally to 11,110 with 263 deaths as schools opened for the first time this year. According to South Korea's Vice Minister of Health and Welfare Kim Kang-lip, 4 nurses at Samsung Medical Center have been confirmed with coronavirus, and there has been another case of infection at a hospital in Gyeonggi Province. Incheon Metropolitan City Office of Education said more than 60 high schools in the city ordered students to go home immediately Monday morning after two students tested positive for coronavirus infections. The beginning of the spring semester has been postponed several times since March as South Korea battled the first large coronavirus outbreak outside China with classes held online. Let's listen to Vice Minister of Health and Welfare Kim Kang-lip.
Focus is to block risk factors of infection from reaching schools, as schools have reopened. And quarantine authorities must prioritize taking prompt action against places visited by confirmed patients if the places include those visited by students, such as cram schools or karaoke rooms.
The only 2 hospitals in Southern California's rural Imperial County were forced to close their doors to new coronavirus patients on Tuesday. This was after admitting scores believed stricken with the virus from Mexico's nearby border town of Mexicali, officials said. According to Dr. Adolf Edward, Chief Executive Officer of the El Centro Regional Medical Center, his 161-bed hospital took in 65 COVID-19 patients on Monday night, while the 106-bed Pilgrims Memorial Hospital in nearby Brawley admitted 28.
We believe they're coming from Mexicali, but they're not Mexican nationals. They're U.S. citizens. They're coming to us because, unfortunately, there was an announcement, or our understanding is that the hospitals there are not accepting COVID patients.
Edwards stated the emergency rooms of both hospitals have imposed a divert order requiring any additional COVID-19 cases be redirected to other medical facilities in the region. Both ERs would remain open to new non-COVID-19 cases, and most coronavirus patients already admitted would remain, he said. A spokeswoman for Pilgrims Memorial confirmed what Edwards said about her facility, adding no one at the Brawley Hospital had yet been turned away. No information was immediately available on the circumstances behind the sudden influx of patients in Imperial County, a desert area with irrigation farming. Brazil's number of confirmed coronavirus cases has just surpassed that of Great Britain's. A director of an emergency center is saying Brazil is losing the battle against the virus. Chris Perez, who is now in Brazil, will report the details why.
Fresh graves were being dug in a massive cemetery in Brazil's largest city after the country overtook Britain to become the country with the 3rd highest number of infections, behind the United States and Russia. Brazil recorded 674 new coronavirus deaths on Monday, according to the Health Ministry. As of today, Brazil has nearly 272,000 known coronavirus infections. For Dimas Covas, director of Sao Paulo's COVID-19 Emergency Center, the world's 5th largest country seems to be losing the battle.
We're losing the battle against the virus. That's the reality. The virus at this moment is winning the war. These days coming up, the holidays, I don't see them as holidays, but I see them as battle days. The most important days in the fight against the virus.
Some locals even say their president is doing a poor job.
I agree with the governor and the mayors. I don't agree with the president because I think he thinks this is all a game. 3 ministers already left in 1 month, and he said several things that shouldn't be said, and that's making us even more afraid.
My opinion is that we should get back to work. If we're going to die, then we're going to die. We should go back to normal. That's the word. You can put that in the media.
There are now almost 18,000 people in Brazil who have died from the outbreak. According to data from the Health Ministry, São Paulo remains the worst hit by the pandemic, with 63,066 cases and 4,823 deaths. Rio de Janeiro is in second place with 26,665 infections and 2,852 deaths. Brazilian President Jair Bolsonaro has lost popularity over his handling of the pandemic, based on recent polls, although he retains a resilient core of support. Last week, Health Minister Nelson Taik resigned, becoming the second top health official to leave the post since the pandemic began. Chris Perez, UNTV, News and Rescue. We serve the people, we give glory to God.
Wen was sworn into office this morning. She embarks on her second term with a record high approval rating despite dim prospects for cross-strait relations. In a speech after being sworn in for her second and final term in office, Chai said relations between Taiwan and China had reached a historical turning point. Chai and her Democratic Progressive Party won January's presidential and parliamentary elections by a landslide, vowing to stand up to China, which claims Taiwan as its own and says it would be brought under Beijing's control by force if needed. Chai faces the challenge of reviving the nation's economy, which has slowed due to strict disease prevention measures at home and months-long lockdowns on countries hit hard by the pandemic. Chai's former Premier William Lai was also sworn in as vice president. Chai, 63, became the first female president in Taiwan's history in 2016. And those are the reasons behind the news here in Thailand and in other parts of the globe. Back to you, William.
Thank you, Kath. You take care there in Thailand.
A Maryland restaurant is using bumper tables as businesses reopen in the USA. The intention is to separate customers and keep them 6 feet apart, according to social distancing guidelines put in place amid the coronavirus pandemic. A video shot by a social media user shows that people were rolling out these customized tables, essentially inner tubes on wheels. This was seen at Fishtails restaurant in Ocean City, Maryland. Fishtails is currently open for takeout, but the restaurant plans to use the bumper tables once they begin seating diners. Our kasangbahay, we are at a time when the country is under a state of health emergency. The cooperation of all Filipinos is imperative to avoid the further spread of the deadly virus.
We are calling on everyone to be calm, and most importantly, let us join together in prayer for our country and for the whole world to survive this.
As flashed on your screen.